Welcome to Brainthropology. Let's talk about our amazing brain and the issues that get us stuck. We all have those moments where life gets overwhelming. It can be related to injury or illness, or an issue with your kids, or just because life is crazy and we need a little help and encouragement. Our team of therapists, expert guests, and clients are here to deep dive into the topics that matter most. We will share information with our listeners that encourages, educates, and empowers.
This episode is brought to you by Galaxy Brain and Therapy Center, helping clients live their best lives by implementing strategies such as those discussed in this podcast. Galaxy Brain and Therapy Center is located in Ann Arbor, Michigan, serving southeastern Michigan for in-person and community-based services. Out-of-state virtual and teletherapy services available for OT, PT, speech, mental health, and mindfulness. Check out their website at galaxybraincenter.com.
Hi, welcome to this episode of Brainthropology. I'm your host, Meg Scaling, and I'm here with Debbie Loftus. Debbie, we like to start our days off and our conversations with a personal or professional positive. What is yours today?
Mine is music. So I am so grateful for music. It's definitely my positive. So on the way in here today, the song Can't Stop the Feeling by Justin Timberlake came on. So today that is my positive. It immediately makes me happy. So music's my positive. What about you, Meg?
You know, I really enjoyed my salad today. So I think my positive is being able to have fresh greens this time of year and fresh strawberries and just have a really great garden salad.
All right, so today's podcast is about concussions. As we know, over the years, there's been an increase in the diagnosis of concussions. Partly, I would say, now because we know what to look for and how to properly diagnose concussions, and probably partly because of the research that's been done, and it's brought concussions to the public eye, is how it affects we play sports. So I think when I think of concussions, that I think of some of the new regulations that have come out. So we both have daughters that play soccer, and there has been a lot of rules that have been changed and mandated for when our kids play sports. I think a lot of this was due to an amazing movie that was put out. Meg, have you seen the movie Concussion?
I have not.
Oh,
Tell
no.
me about it. I have not seen it.
Oh my gosh. So you need to see it. And anybody, all the listeners out there, you need to see that movie. So, it is a movie with Will Smith, and it is Will Smith playing Dr. Bennett Omalu, and it's about CTE, which is chronic traumatic encephalopathy. So the premise of it is it's about a forensic pathologist who fights against the NFL, trying to suppress his research on CTE. And it's about CTE and brain degeneration for those football players that have sustained repetitive concussions. So it's really an amazing movie, so I highly encourage you to watch it. So as we jump into this, Meg, as you took the American Institute of Balance certification for vestibular therapy and concussion treatment, I think I want you to dive into this topic and kind of give me an overview. Can you talk about what happens to the brain after you get a concussion? I think it's such an important topic these days, and you have so much experience on it. I would love to hear your take on it.
Yeah, I think if today we covered an overall concussion, what happens with the brain, how should we address this? Because I see over and over on Facebook support groups, people saying, I should be getting better and I'm not. And is it normal that I have headaches all the time? Or I had a good day and now I have a bad day. And so I think we could bring experts in to talk about all of the things that's actually happening on a metabolic level of the brain. However, I will probably not do it justice, but I will explain a little bit because I think it's important to understand metabolically what happens after a concussion.
Absolutely.
And I'll kind of go out of order a little bit because you mentioned CTE. Mm-hmm. And I believe that we actually met that gentleman at a conference years and years ago.
We did, a brain injury conference.
We did. Yeah. I actually never saw the movie, but I met the gentleman who the movie was about.
Very kind-hearted. I mean, we actually have a picture that's kind of fun.
Yeah. So when you talk about CTE, that's a diagnosis that really is only diagnosed through autopsy. Mm-hmm. So it's why it's why the normal imaging that we have today doesn't really detect CTE.
Right, because you have to splice the brain, and you don't want to be alive to do that.
and what that is it's not just concussion. It's these subconcussive hits. It's small impacts. It's people like our daughters who had the ball over and over again as defenders. It's people who play football that might get tackled. It's boxers. They might be, jarring, and they might not pass out. They might not have a concussion, but it's these subconcussive hits that happen over and over again. And what they're learning about, again, I'm not going to do it full justice, is that there are these tau proteins that are around the axons of the nerves. And these tau proteins are really stabilizing. So they provide a little bit of stabilization and structure to the nerves. And when you have axons that are sheared or these subconcussive hits, what the belief is these tau proteins break off and then they start to clump together. So what they're finding in these athletes is small protein clumps of this tau protein that clump together, and then over time they also continue to regenerate, and that those tau protein clumps expand, taking up brain space and killing the tissue around it. And so that is diagnosed through autopsy. Mm-hmm. But that is why these subconcussive hits, some people are having issues, and CTE is something that is, something we can talk about, but sometimes it's the issues that you see in concussion are really a combination of these subconcussive hits. So if I were to, that's one thing that's happening. The other thing that's happening in the brain is that axons might bend or twist or shear. So an axon is a nerve. And when your brain either gets hit from a blast injury, like what happens usually in war times, or whether it's a car accident, or whether you're hit by a lacrosse ball, or whether even it's whiplash and you have that coup contra coup, where your brain, that is this 3-pound mass of a gelatin-like substance, is sloshing to the front of your brain and then the back of your brain. When those kind of things happen, axons can get damaged. And when the axons shear or they break apart, you can just picture tiny little particles of potassium leaving the cells. And if you've ever done general osmosis, if you've ever done those, labs in 7th or 8th grade, what you learn is when something leaves the cell wants to stabilize itself. And so what happens is calcium then rushes into the cell. So if you can picture potassium leaving the cell that's supposed to be in the cell, and calcium rushing in the cell that's not supposed to be in the cell, you can imagine this instability that happens. And those nerves are now very fragile. And what happens as a result of that, it causes blood vessels to constrict. And so here you have this really vulnerable nerve that is under a lot of stress. And this vulnerable nerve, when it's under stress, it can cause death or serious damage to even the surrounding cells. So there is actually metabolic changes in the brain when you have a concussion. And the reason you feel like you need to sleep all the time and you have some of these issues and this headache and it's physical symptoms almost instantly is because you are having a metabolic breakdown in your brain.
Yeah, it's interesting because the physical symptoms that I've had experience with, like I said, our daughter's having a concussion in soccer several times. Initially, you have that initial feeling of being dazed and confused. Sometimes there is a loss of consciousness, or sometimes there's no loss of consciousness, and you question if it's a concussion or not, and sometimes symptoms don't show up immediately. I know initially my daughter had issues talking. When we took her to the doctor, they said, can you give us your full name? Can you give us your address? And she actually stumbled upon saying that information, which was kind of scary.
And how old was she when that happened?
Probably about 13.
Right. So you should know your name and your address.
And birth date.
Right.
Yeah.
When my daughter had a concussion in 5th grade, they asked her to do some basic subtraction, and she just started to cry. Yeah. She couldn't do it.
Yep. And then what we typically think of, I think, is, having a headache. So initially having that, severe headache, sometimes nausea and vomiting goes along with it as well, fatigue, drowsiness, and then our wonderful topic that we brought up several times today, vision issues. So really sensitive to light. So afterwards we had stopped at the grocery store, and my daughter, she's like, Mom, can I wear my sunglasses? It's like, what? We're in a grocery store. And then you kind of, all the things fall into place. You're like, wow, you must have really been hit hard.
And people with concussions know what grocery stores have those fluorescent flickering lights and which ones don't. And they can tell you, like, I will not shop at a Walmart because they all have these really bright lights.
Right. And that brings me to the topic the idea that it is a type of brain injury. So a concussion is a type of brain injury. So this really goes along with brainthropology, that, we're talking about the brain, we're talking about brain injuries, and concussion is one of them. Another issue that she had was issue sleeping. So she sometimes has problems falling asleep, but after the concussion, she wanted to sleep all the time.
And sometimes they have a hard time staying asleep.
Yeah. So those are some of the physical symptoms, but there's also auditory symptoms. So, in your learnings, have you, talked about what kind of auditory symptoms go along with concussion? Have you experienced that?
Yeah, absolutely. I think about people getting this like supernatural hearing. It's like most people who have a concussion all of a sudden can hear everything, and they can't tune it out. So they hear the lights buzzing, and they hear the creaking of the furnace, or they hear the ice maker going off, or the refrigerator, or just every little thing. Maybe their siblings bother them. The sounds bother them. The sounds of people shuffling their feet in school bothers them. They're very distractible. And so I think that from an auditory process, they have a hard time figuring out that foreground noise and background noise. They get distracted a lot. And I think that auditory sensitivity plays a little bit into that noise sensitivity that contributes to insomnia too. That difficulty falling asleep because you're hearing things, and having that difficulty shutting out the noise.
So we talked about visual symptoms, auditory symptoms. We talked about physical symptoms, auditory. Within the physical, we talked about some visual symptoms. So we talked about the lights are too bright, but there's also some symptoms that involve things that you do on a daily basis in school and at work. So reading. So a lot of times after concussions, you have difficulty reading. You find that words kind of jump around on the page. And you also have poor accommodation. Accommodation is a word that we use when your eyes aren't working together. And also poor depth perception. And when you think about walking and the perception that you need not to be able to fumble on a step or to get through a doorway, those are really important skills. Meg, can you talk to us about any other vision issues? Just because I know you took that class and they really dove in to some of the vision issues that that go with concussion.
Yeah, I think you really need to look at the vestibular ocular reflex, and that's a vision issue where if you look at your finger, just look at your fingernail, and try and keep your eyes on your fingernail while turning your head left and right. Keep your eye fixed on that. That's your vestibular ocular reflex that lets you turn your head and stay focused on something. And that often there often can be problems with that after a concussion. That also ties very closely to your inner ear. And the vestibular side of concussion, a lot of times with concussion, you have vestibular issues as well. And so you really have to separate out what is truly vestibular, what is visual, and what is a part of these, visual symptoms of the concussion. So the vestibular ocular reflex is a good test, because if you have difficulty with that vestibular ocular reflex, that's kind of an indication that there might be some vestibular issues going on. And the vestibular issues are in your inner ear, the semicircular canals of your inner ear, and your inner ear plays a really big part of balance. So if we will go into vestibular issues, but if you have issues with where the room is spinning for, 5 to 10 seconds, sometimes up to 30 seconds. And then once your head is still, those issues kind of go away. It could be that part of the concussion, part of the impact knocked crystals loose, this otolith crystals in your inner ear, and knocked those loose, and you're having issues with your inner ear.
And I know there's treatment for that.
There is treatment for that. Don't ignore that. If you have vestibular systems and you have dizziness and nausea, and it only lasts intermittently when you turn your head, when you're looking up or down or you're looking side to side, that could be a peripheral issue with your ears and your inner ear. That can be fixed in one session. So don't wait, because there's ways to fix that. The other thing you might see on the visual side involves something called binocular vision dysfunction or vertical heterophoria.
Say that again.
I know, right? It's a big word, but when I think about our amazing brain and how no matter what, if we are not symmetrical. We think we're symmetrical. We think our eyes are even and our ears are even. But if anyone ever tried on a pair of sunglasses or had a prescription lens made for them, you realize that like one ear is usually higher than the other, or one eye is higher than the other, and you have to make some of these adjustments. Well, we're born like that. We're often born not 100% symmetrical, but our brain can make up for that. Our brain knows, okay, my left eye is slightly higher than my right. I can make up for that. And it figures out how to interpret things the way it needs to be done. But what happens with concussion sometimes is that brain, when you think about, okay, you hit the back of your head, right? You have a concussion. You might have hit the back of your head. You might have damaged part of your occipital lobe too. Mm-hmm. When that happens and your visual center is also affected, your brain needs a little help. And so what you might see is if one eye was higher than the other, and my brain could correct it, but all of a sudden my brain can't correct it, what you see is a head tilt. So now, even though this eye is higher than the other, I'm going to tilt my head to try and make things even. And so what you'll see is one shoulder higher than the other, one trap tighter than the other, a little bit of head tilt. You'll sometimes see when they're walking, they might drift to one side of the hallway. So if you notice that you're tilting your head more and that you're drifting to one side of the hallway, you might have something called vertical heterophoria. And that can be fixed with both a combination of visual therapy and prism glasses.
Well, that's promising. So along with the visual issues, there's cognitive and executive functioning problems. Again, my favorite topic.
Okay, then you talk about that. I've talked enough.
Executive functioning. So again, I'll just briefly go over them again. Problem solving, multitasking, organization, planning, having a hard time making decisions. So sometimes after a concussion, a phone call will happen and they'll answer the phone and somebody will ask them, can we go somewhere in 20 minutes? And they're like, yeah, I don't know. Really hard time making decisions, or even getting dressed in the morning, right? Like I cannot decide what to wear, and that's very stressful on somebody because of that blow to the head with the concussion. So prioritizing time management. So sometimes simple tasks that would only take a couple minutes, they find take like 30 minutes for somebody to fill out their schedule for the week.
You're talking a lot about issues related to the frontal lobe.
Yep.
And that makes sense because in a concussion, it's usually the back of the head and the front of the head. It could be the side. It could be lots of different ways you get a concussion, but often it's either whiplash or falling back and hitting your head. And so it's usually the front of the head and the back of the head, which is a frontal lobe, which is what you're talking about.
Yeah, I would say that's the most
executive
common.
Functioning.
Yeah. The other area is many times people have a hard time concentrating. And as I stated before, a concussion is a type of brain injury. So a lot of this might be repetitive from our last podcast when we talk about executive functioning problems with the frontal lobe. So really, if you're reading a book, having a hard time concentrating on that one page or one word, and really getting frustrated, it can cause a headache and some of those other physical symptoms. And also communication issues. So having slowed speech, slurred speech, having a hard time responding to somebody where normally would only take, a second might take 5 or 10 seconds, which leads to communication problems. So, in your experience, when somebody has a concussion, have you found that they have issues with communication?
Yeah, absolutely. When you talk about slowed speech, it's slowed processing too. Mm-hmm. So it's often like talk slower. I think I had one client early in my career that just said, Meg, stop talking. You're talking too much. If you're going to talk this fast and you're going to talk this much, you can leave.
Yeah.
I was like, okay,
it's overwhelming.
I get it. It's overwhelming. And it's really that talking slower and making sure that there aren't too many people talking at once. A lot of times they don't know how to organize their thoughts. So it's that inability to start something. I don't know how to say it. I don't know how to start. What if I don't remember my address? What if they ask me a question and I don't remember my zip code or my address, or that thinking on the spot becomes really difficult. And they want like a lot of predictions. They want to know that, okay, I need to be able to predict what you're going to ask me so that I can prepare a response. And real life doesn't allow you to do that. So I think about, I also think about a client of mine that brought a school newsletter to me, and she's like, okay. She's like, I know this teacher is trying to save trees, but there is way too much on this piece of paper. It was like 3 columns and, trying to get everything you can possibly get from an elementary school announcement onto one page. And it was so overwhelming. She couldn't even look at it. It was so visually overwhelming. And so it's breaking things down, underlining the words that matter, circling the words you have to do something with. And it's coming up with strategies like that. And so I think communication is really huge, and it's really important if you have a concussion that you advocate for yourself. Please talk slowly. Can you write that down?
Absolutely.
I didn't follow that.
We can put in the show notes. So at Galaxy, we have come up with some compensatory strategies, and we've come up with a great advocate letter that you can give to your work or you can give to your school if you've had a concussion, you're having issues with these. So we'll have to make sure we put that in the show notes.
Absolutely. So that's what I think about when I think of that concussion. And I also think about how, if we go back to a previous podcast, how the limbic system and the temporal lobe and the frontal lobe are all working together. And so when you have issues, this makes sense that you have some mental health issues too with concussion.
For sure. Absolutely. A lot of mental and cognitive changes happen. You talked about some of the metabolic processes that happen after a concussion, but after a concussion, it's common to see mood changes. So, many times people will get really irritable or have sudden mood changes that are unexplainable. So there isn't a reason for it. And that can lead to depression. So part of what you had said before is, when you're overwhelmed and when you try to anticipate what somebody's going to say, when you can't anticipate it, that can cause a lot of anxiety and frustration for someone. And that leads to change in behavior. So if you're talking to a friend that you're used to be, is supportive and, normally is joyous and jovial, and all of a sudden you're talking to them and they're sad and they don't know how to respond to your situation correctly, it's very confusing to somebody, and that can affect your social relationships. Many times we see that people are easily angered. I guess you would describe it as like a short fuse, and also social avoidance. So you can have someone that loves to go to parties, that loves to host family gatherings and holidays, and all of a sudden you see them being, they pull away and they're really avoiding any social situations that may put them in a very vulnerable situation that they're trying to avoid. Many times we see people trying to mask their deficits. So have you had an experience with that?
Yeah, I was actually just thinking about how people do mask their deficits and how they fake it till they make it. Mm-hmm. But it's really, I think, in combination often with family members that really don't understand and they don't get it. You've said it, I think, twice now, that a concussion is a mild brain injury. And a concussion can turn into a moderate brain injury if we keep stressing our system. But when I think about that, I think about how family members are like, all right, you had your concussion like 2 weeks ago. Can you just get over it? Like,
Right.
why? Okay. Are you done being dumb? Like, are you still going to milk the system? Because your concussion should be over by now, shouldn't it be?
Right.
And there's this false narrative that concussions should all heal within, 3 days to 2 weeks. And that's not reality. And there's a combination of things that contribute to that, which we'll talk about. But this feeling like I need to keep doing what I'm doing. I need to push through. I need to go to work, because if I don't work, I don't feed my family. And even though I have all these issues going on, and even though I'm feeling worse and not better, and even though I'm not thinking well, I'm going to fake it till I make it. And that's not healthy. That's actually contributing to part of the problem.
Yeah, for sure. We brought up a couple times how our teenagers have been affected, but I think it's really important that we address children's symptoms as well. So can you speak about how it could present itself in a child that you might not realize that they've had a concussion?
Yeah, sure. I think most people are pretty in tune with their own kids, and you know what their typical behaviors are and how they typically sleep and what they typically play with. And so when you start seeing changes in eating habits or nursing habits, they're fussy, they're not eating, or they're like wanting to eat more, they have this irritability about them, or persistent crying, where normally you can console them and whatever you normally do isn't working anymore, or they don't pay attention as much. You might see changes in sleep habits. It could be more sleeping all the time, not waking up as much, or it could be just intermittent sleep or crying a lot during sleep. Seizures. So my daughter, when she had her concussion, it was followed by a 30-second seizure. So that can happen. You might see that a child is sad or depressed, and they just don't want to play with their toys, or they don't want to get together with their cousins or their friends. Overall drowsiness and just a lack of interest. I know that my teenager, when she had her concussion, actually she was more in 5th grade, so not a teenager. It was a lot of crying, a lot of emotional liability, a lot of sleeping and napping, and and sleeping on the couch, where normally she would be up and active, and just kind of wherever she's at, she was sleeping.
Okay, so we've talked a lot about concussion, and there's something called Post-Concussion Syndrome, and sometimes there's confusion between the two. Can you kind of give a good discussion on the difference between the two?
Post-Concussion Syndrome is really complicated, and there's a lot of things that contribute to that diagnosis, but in general, anytime your concussion symptoms last for more than 6 weeks or so, we're probably looking at this post-concussion symptom. And this post-concussion syndrome is something that is talked about in the research. There's actually quite a few different opinions on it. Some people are recognizing that it's very treatable. I fall on that side, that it's very treatable, but it takes a holistic treatment approach. Usually someone with post-concussion syndrome has had a history of maybe some comorbidity that has complicated, your brain is complex. And so if you have some comorbidity, which means maybe a history of trauma, or of a history of anxiety, or a history of depression, it does make recovering from a concussion all that more difficult. Not impossible, but it really does take a holistic approach. So I think too, if I were to talk about post-concussion syndrome, I really think it's important first to talk about the different kinds of concussion, because concussion is one word, but there's a lot of different types of concussion. And the University of Pittsburgh Medical Center, I think, does a really great job researching concussion. And if you want to dive deep into some of their blogs, they just do a great job talking about the different kinds of concussion. So I encourage you to go to that website. But there are different ways concussion can present itself. So for some people, concussion is more vestibular. And I'm going to give you 6 different ways it can present itself. And it can be you can have one of these, you can have two of these, you can have three of these, you can, it can be a combination of symptoms. But one of the symptoms is a vestibular concussion. And so people who have a concussion might feel like most of their symptoms surround issues with balance or coordination, or that head movement in that vestibular ocular reflex I talked about, or that vision stabilization, like have a hard time focusing. The other is more on ocular motor, which is similar to vestibular. Vestibular, I think of like balance, nausea, dizziness feeling. Ocular motor, I think of difficulty with eye coordination. You talk about reading difficulties, more headaches and eye fatigue when you have to do any kind of pen and paper task or reading tasks. So we've talked about vestibular, we talked about ocular motor. The third one is cognitive. So some people might not have any symptoms except for cognitive issues when it comes to concentration and learning and memory and attention. And some people may have all three of those.
And so you said you can either have one, or you can have a combination of two or more. So
correct.
Okay.
So we talked about vestibular, ocular motor, cognitive. The other one is post-traumatic migraines. So some people, their concussions really present as a really intense headache with some nausea. This is where you see that light and noise sensitivity playing their part. The other one is a cervical headache. So some people, their concussion really is, it settles at the base of the neck and that occipital area, and they have this, your cervical area is your neck. It's where your head attaches to your neck. And sometimes it's neck pain and cervical pain, and so everything else might be fine, but maybe they have that. And the other one that I think is talked about the least amount, and it is associated with this post-concussion syndrome, is anxiety and mood. And that's where there's this anxiety and irritability. I've actually heard someone say, I've heard a physician once say, at this point, you've physically recovered from your concussion. Now it's just emotional.
Oh, wow.
It was shocking. And I was like, okay, here's someone who doesn't sit on the side of the fence that I do, or that doesn't sit on the side of the fence with the University of Pittsburgh Medical Center, that also recognizes that this anxiety, mood, irritability, it's all part of the brain function, and it's all part of this concussion that can be treated.
And how not validating to the person on the other end. I mean, that's really hard to hear.
And I guess it's good to really make sure that you understand that these 6 things are all part of concussion, and you need to find a physician that is going to support you in your recovery.
Right. Speaking of recovery, as a therapist, what's going through my mind is how to treat it. So with all of these, you just defined 6 different primary trajectories a concussion might take, right? And what is the best treatment approach for a concussion?
Yeah, it depends on what symptoms you have. So if you have a vestibular concussion or oculomotor concussion, that's something that there are specific exercises that you need to do with a PT. Same with cognitive. There's specific things that you would do with your speech or occupational therapist. In addition to post-traumatic migraine and cervical, there might be physical modalities that you need to kind of treat that.
In my head, I think of massage therapy too. Right?
Absolutely.
I mean, if you're having headaches, you can do an OA release and different manual techniques for releasing your upper trapezius muscle and things like that.
Yeah, absolutely. And when I think about anxiety and mood, there's a lot of occupational therapy that I think is tremendous in this area, helping people be successful and have positive outcomes in different settings that might be difficult for them. So I think, I guess a big disclaimer and really important thing I need to say is that concussion therapy really needs to be carefully monitored. And whatever speech and PT and OT are doing, they need to be in constant communication with each other, because it really is important for the person that has the concussion to get a just right challenge. And if one of those disciplines did too much in a session, it's going to have negative consequences. So it's really important that all disciplines spend a lot of time educating clients to help manage their triggers and be self-aware of their symptoms and symptom management.
So talking about treatment in a clinic setting, which is wonderful if somebody has access to OT, PT, speech, and a physician, what about listeners at home that don't have access to that? So, Meg, how can somebody manage their concussion at home if they don't have access to skilled therapy?
Yeah, there's definitely a way to do it. And I think the biggest thing that people need to do is identify their triggers, identify the things that set them off, and pay attention and journal to the days you feel good, and then the days that you feel bad, what did you do the day before? Find out what it is that are some of your triggers. And when I have to tell you, every single person that listens to this podcast, you need to get out a pen and pencil right now, and you need to write down these 3 things. Because there are 3 major things we're going to talk about today that will help you manage your symptoms and be on that trajectory of getting better every day rather than 2 steps forward, 3 steps back. The 3 things are, number 1, managing your anxiety and your fight or flight response. I'll give you a second to write that down. Manage your anxiety and your fight or flight response. And we'll have this in the show notes too. Number 2, managing your heart rate. If you have an increased heart rate, that can cause something called a metabolic concussion cascade. And the 3rd thing is managing your cognitive load. So those 3 things, managing your anxiety, managing your heart rate, and managing your cognitive load. The other thing is you need to think about your symptoms. So symptom management means if I just start developing a headache, if I start feeling nauseous, if I start feeling dizzy, if I start losing my balance, if I start having fatigue or mental fog, or if I start having light sensitivity, those things, headache, nausea, dizziness, balance, mental fog and fatigue, and light sensitivity, are all symptoms. You don't have to have all of them. Even if one starts to get bad, pay attention to that.
So I know in school, when we briefly touched, these topics, they would have you use a scale. So I know there's different scales, 0 to 5, 0 to 10. What would you recommend, how people rate this at home?
So at the American Institute of Balance, they referenced a study that recommended a 0 or a 1 to 5 scale. Most people are so accustomed to the 0 to 10 scale that we all see when we go to the doctor's office. So typically I use a 0 to 10 scale. And so what you have to do is think about how you're feeling. If you wake up that day and you look at your symptom list, do I have a headache? Nope. Do I have nausea? Maybe a little. It's at a 3. Do I have dizziness? Nope. Do I have balance problems? Nope. Do I have mental fog? Yep, that's at a 4. So if I rate my highest level of symptoms at a 4, I'm waking up at a 4. Statistically, and what the data shows is that you should not jump more than 4 levels. So I should never in that day jump from 4 to 5, 5 to 6, 6 to 7, 7 to 8. If I jump to an 8, that is my brain interpreting that as a stress response. So it's hard to describe, but if you could wake up and say, my symptom's at a 4, I'm going to try and go to the grocery store. Just driving to the grocery store, I'm already at a 6. So maybe I need to take 5 minutes in my car and just meditate and just relax, get myself at least down to okay, now I'm a 5 because I'm a little anxious, right? Mm-hmm. So my anxiety is making me like a 5. So then you go into the store and you're pushing the shopping cart and you're having to scan the aisles, which is causing visual issues. So now you're back up to a 6. You might have to sit in the front of the store, calm yourself down, get back down to a 5, because if you get to an 8, you can have this metabolic concussion cascade. And I want to read something from the University of Pittsburgh Medical Center. It's on their website, and it says, it kind of taking us back to that metabolic picture when we talk about the symptoms and that calcium rushing in as the potassium rushes out. It says The nerve cell is extremely vulnerable in this condition, and further injury or stress while impaired may cause cell death or serious cell damage. So what is happening when you are pushing yourself through
So above that 4 points.
Above that 4 points, what studies show is that once you reach that 4 points, you have pushed yourself into a level of stress that could be metabolically injuring yourself over and over again. So this, I'm going to be strong. I'm going to push through. I can do this. You're actually hurting yourself.
So instead of progressing, you're regressing.
Right. So you push through and you decide, I'm going to get everything on my list. I had 20 things on my list. I'm at my 7. I feel like I'm at an 8. And for some people, it's not even 4. Some people it's 3 levels. But I'm at that level and I'm just going to push through and get the last 5 things. Well, guess what? Shame on you, because you push through, you get the last 5 things, and guess what? You sleep 2 days later, because your brain registered that as a stress response. Now, I want to start a different scenario, because it's really important. What if that same person who always wakes up at a 3 or a 4 woke up that day at a 1? No symptoms. 1 symptom, a minor headache at a 1. They feel like, wow, I feel great. On a typical day, they start at a 4 and they have to not get up to an 8.
Sure.
Right? Today they're at a 1. Guess what? You can't get up to a 4. Right. You can't push yourself to that 8. It's not about the level that you can max out at. It's about the level where you're at and making sure that you don't increase symptoms quickly, because your brain interprets that as a stress response and might have a similar metabolic reaction.
Wow, that's a lot.
I know.
That is complicated, but excellent information. And it so reminds me of some of what we see with mild traumatic brain injury when we're talking about executive functioning and we're out in the community and we tell people, we don't want you to get above a 4 as far as being overwhelmed. And when they get to be a 6 or 7, they will sleep for 2 or 3 days. It's all about that self-regulation. So what would you say the prognosis is for a concussion?
If you have a concussion, and if you have even vestibular issues, and you have balance and dizziness issues along with it, I think vestibular concussions are harder to recover from than some of the others. But if you are applying these principles, if you have the appropriate just right challenge, you're challenging yourself enough, but not too much. And if you give yourself what studies say are 1 hour of cognitive load a day to start out with, which for a working adult, tell them that they can't use their phone but for 1 hour, or look at email for 1 hour.
Good luck with that.
Right. Studies actually show that if a person with a mild to moderate concussion could take 6 weeks off of work and gradually return to work, they will actually have a very good prognosis. If that same person pushes through, what we typically see is they push through, and it's usually at about the 3-month mark where their work starts to notice. They can't fake it. They can't mask their deficits anymore. All of a sudden, their work, their employees around them, or the people they answer to, start to notice that their work is compromised and they're not doing the same job. Usually it continues to decline. Usually by 6 months, between 3 and 6 months, they seek help and they realize that this concussion is much more serious than they thought. It usually takes another 3 to 6 months to rehab them back. And if you don't take it serious, it's usually about 1 full year before you return to baseline.
Wow, that's incredible. So, I mean, as far as what all this means, for the general population, it sounds like the number one and most important thing is to listen to your body. And
Absolutely.
If you listen to your body, you'll continue to gradually improve. And if you don't listen to your body, that you're going to continue to contribute to additional metabolic changes.
Absolutely. That is the number one message. And I'm not saying if you push through, you're going to not be good for a year. That's not true. But every day you push through and you don't listen to your body, then you have metabolic changes. So remember those 3 things. The first was anxiety, and I want to deep dive into that. Anxiety is one of those external triggers. And when you think about the fight or flight response, anxiety does something metabolically to us. You know, when you have anxiety, you have this fight or flight response. And so you do have hormones going through your body, and it does cause a stress response to your brain. What else happens when you have anxiety is your heart rate increases. And that's a second thing that we have to monitor. So physical therapists will monitor with the heart rate with the Buffalo treadmill test and make sure that you have that you maintain a heart rate that is within a good range for you. And so number one, monitor your anxiety. And how do you do that? Because anxiety is something that both is internally triggered and externally triggered. So when I think about internal triggers, your symptoms are some of your internal triggers of your anxiety. Maybe your stress level. It might be you have a headache, and that causes you to have a little bit more anxiety. But there's also these emotional triggers to anxiety. And what emotional triggers do you think about when you think about emotional triggers?
I guess when you're in social situations, social and emotional interactions during your day, that can cause anxiety. I guess, if you're running late for something, it causes anxiety. I guess there's things, your nutrition. Have you eaten? Have you provided your brain energy? Those kind of things. And I know there's also external, right, triggers.
Yeah, totally.
That to me is more common when you hear the external. So to me, an external trigger would be, if you go to a crowded area, or you're going to a concert and it's loud, or even something as simple as, how did you sleep? Right? So to me, that's an external trigger. Emotional events and conversations, that can cause anxiety as well.
Yeah, fighting with your kids in the morning. Right? Did you fight with your kids? Were you running late?
Did you run out of gas on the way to the podcast?
Right. Is the weather bad? Right? Like, was the weather similar to the weather that, when I slipped and fell on the ice, or when I was in that accident? Was it raining that day? Different things are going to cause this heightened anxiety. So if you can identify those and also decide, like, I had a fight with my boyfriend. It's raining outside. I have all these issues. Is this really the best day to go and, try on that new coat I wanted to try on, or whatever?
So really taking a moment to anticipate what could be a potential trigger to keep yourself out of that 4-point increase zone.
Right. For instance, I had a client who I saw, and she was just like, I had almost a full panic attack. I set myself back, and we started talking about it. And I said, well, wow, what happened? She's like, well, I went to a movie, and I went to the Marvel movie. It was one of the Marvel movies on opening day. And I said, well, and she said, and the lines were so long, da, da, da. And I said, well, what was your first clue that maybe this wasn't the day to go? Mm-hmm. Well, they couldn't find a parking spot. If you go into the movie, the parking lot, and you can't find a parking spot, there's a good chance there's going to be that many people inside too.
And there's also, with those auditory sensitivities, that I actually have a great example. I have a great friend that will not go to the movies, but she was determined to go see actually Maverick, the new Top Gun movie. And she really has a hard time with people eating. And in the theater, if you think about, what do we commonly see in a movie theater? Eating popcorn, a mother with children giving her snacks and slurping Slurpees. And so in order to do that, they thought ahead that going to an afternoon show, so a 2:00 show, there would only be 10 people in the theater, or even going on the website and seeing how many tickets were purchased. So there were only 10 people in the theater. And although you can't avoid it 100%, at least you're decreasing what should happen.
Yeah, and you're planning ahead. So This is the thing. You take control. You make sure that you are monitoring your anxiety. And I'm not saying don't leave the house, because that's not going to help you either. Your brain, if you want your brain to get better, you need to work on things, and you need to learn how to be in environments. But what I'm saying is you are monitoring yourself, how you feel on the inside. You're looking at the activity you're going to do. You're going to look at the external stressors. And then you're going to look at, also, this kind of plays into your heart rate, you're going to look at, what is the task I want to do? Is this a task where I'm going to be, walking up hills or down hills or carrying heavy groceries? Or am I going to try and take a fitness class that might affect my heart rate? A lot of times you don't think about that when you're thinking about shopping and that. But if you haven't been physically active and you start walking, your heart rate is going to increase. And hopefully you know what range you're at. But if you start to get symptomatic because your heart rate is increasing, then you know that you need to slow down.
So from an outsider, it sounds a little overwhelming. So I guess I want to encourage listeners to use a strategy, which is what we do as OTs, right? And to write things down. So you're talking about tracking heart rate, which nowadays, if you have, a watch that takes your heart rate, or a blood pressure cuff you can get for $20, at a local drugstore. It actually has your beats per minute. That would be one way of doing it. And also just having a chart. Having a chart that lists the date, lists your symptoms, and then you can have your 0 to 10 rating scale. So you can actually objectively compare that instead of having to try to remember it. Oh, was I a 4 yesterday? Was I a 2 yesterday? So that would be a good strategy as well.
And to recover from a concussion, the first thing you want to do is see if you can go for a slow walk without increasing symptoms. And if you can do that, that's a good sign. So you're going to go for a walk, you're going to maintain your anxiety, you're going to decrease those symptoms. The third thing you have to monitor that is one of these triggers that can cause concussion cascade, that metabolic effect, is cognitive load. And when you think of cognitive load, it's not rocket science. It's not math problems. I mean, it is, but it's looking at your phone. Mm-hmm. It's following a social media feed. It's watching a TV. It's reading a short article. Those things are cognitive load. It's having a conversation with a friend.
And actually adding something in the background too that you normally wouldn't do. So for example, if you're watching TV for a short period of time and the phone rings and you have the TV on and you're talking on the phone and the dog is barking and the front door is ringing, the doorbell is ringing, those are things to pay attention to as well.
Yeah, absolutely. And so again, you don't want to push through this task. You have to be paying attention to your cognitive load. So what we do at Galaxy, where you and I work, is when we have clients who might have OT, PT, and speech, they have 3 disciplines. It might be PT's working on vestibular therapy. It might be speech therapy is working on some cognitive issues, and OT is working on maybe getting them back into the community. We have to really carefully talk and communicate. So we would say this person came in at a 3 out of 10. They got up to a 4 or 5 out of 10. We rested a little bit, but if they escalate really fast, sometimes therapy for some people is 10 minutes long because whatever we did with them, their symptoms escalated so high and so quickly that we had to be done. They rested the rest of their hour of therapy, and sometimes that's what it takes. Sometimes stopping is the best choice.
So as a recap, so it sounds like for everyday precautions, like I said, even if somebody is at home that doesn't have access to OT, PT, speech, is to monitor your exercise, monitor cognitive load, avoid triggers that cause that fight or flight anxiety response, use that 0 to 5 scale, and then when in doubt, make sure you reduce that cognitive load first.
Yeah, or that 0 to 10 scale. So on a 0 to 5 scale, you don't want it to go up more than 2 numbers. On a 0 to 10 scale, you have like that 4. So yeah, so if you're going to work on getting better, start with a walking program. And if you can walk, and maybe then work on some visual or vestibular issues. So if you can walk and you don't have any issues and your symptoms aren't increasing, you could try a light jog. You could try increasing your physical demand a little bit and see what happens. Then you might try some visual tracking. You might try that VOR reflex where you're turning your eyes and your head and making sure you don't have issues there. Then you might try cognitive. In vestibular therapy, we like to do all of those at once because it really does improve brain efficiency and it helps you get better by more than 30% when you can do all of those at once. However, the person has to be ready for that.
Excellent.
Yeah.
Well, that is a great overview of concussion. Is there any other tidbits that you wanted to share before we close out this podcast?
No, I think you said it best, to monitor your anxiety and really pre-plan, really think about the situation you're going into, and don't be hard on yourself.
Give yourself grace.
Give yourself grace, give yourself some time, and also be transparent. Let your family know what's happening and let your doctor know what's happening. And if you're having issues and your family member is like, why aren't you better yet? Have them listen to this podcast. Send this to your friends and family so they have a better understanding of how to help you, and see someone that's a vestibular and a concussion certified therapist. I guess I will say there are a lot of people that claim to understand balance and concussion, and a lot of people might take a 2-hour seminar, or they might watch a webinar, but there's really a lot to it. And when we did the American Institute of Balance is where we did our training, and it's a week-long session. And I remember when we did it back in 2016, what they told us to do was much different than what we learned in 2018 even, and in 2020, because things are always changing in this world. Yeah.
Excellent. Well, we hope that you can take some of the information presented today. You know, if you have a relative with concussion, like Meg said, share this podcast, and hopefully we can get the information out there.
Yeah. Thanks for having us. And I'm really hopeful that this will help someone that's out there just searching that doesn't have access to care.
And as always, be courageous and move forward in your day with hope, joy, and purpose.
While we love what we do and are as passionate as they come, the information on this podcast and discussion is for educational purposes only and should not replace professional medical advice. Please consult your own healthcare provider if you are seeking medical advice, diagnoses, or treatment for you or anyone else. We do our very best to provide correct information, but please understand science and medicine is ever changing. We welcome feedback, comments, suggestions, or correction of errors. This disclaimer applies to any guest or contributors to the podcast or blog.